It's the time of year of family gatherings, office holiday parties, and winter illnesses. Here to discuss what you should be on the lookout for and how to protect yourself is Dr. Amanda Thomas with Bluebird Kids Health. Doctor, thanks for being here today.
Thank you for having me.
Let's go and start with what illnesses are you seeing already circulating, and what's the outlook for the winter?
Well, we all know that winter viruses are pretty common this time of year. We see numerous kinds of viruses, especially in children. Depending on the child, healthy children can fight off viruses normally just fine, but there are some viruses that can affect kids, especially younger children, that can make them quite sick. So viruses like influenza, which we know as the flu, and RSV, which is the respiratory syncytial virus, can oftentimes cause kids to become quite sick, even to the level of having to go to the hospital because of their illness. So it's very important for us to take preventative measures in order for us to protect these children.
I also was reading that there's some stomach viruses out there as well. Are you seeing that as well?
Well, all viruses have the tendency, or can have the tendency to cause stomach symptoms. So some viruses, even the flu, can cause vomiting, diarrhea, and just general tummy upset. But there are some other gastrointestinal infections that can cause pretty serious vomiting and diarrhea symptoms in kids.
When should they seek medical care for themselves or for their kids?
When we worry about a child is when they're having respiratory trouble. So they're breathing extra fast or more rapidly than usual. They're having difficulty feeding or drinking any fluids, so that can quickly lead to dehydration, and recurrent fevers that are ongoing for a couple of days. Those are all things that should be evaluated by a medical professional.
And how do we protect ourselves this time of year from getting sick? No one wants to ruin their holidays by being sick through them. What's your best advice?
Good old-fashioned hand washing is really important. It goes a long way. So making sure that we are taking the time to wash our hands with soap and water and encouraging our little ones to do the same. But also what we really need to do is emphasize the importance of immunization and preventative measures in the form of vaccination. So things like getting the flu shot every season is very important, and having the discussion with your doctor about whether you're a candidate for getting other vaccines that could prevent from certain illnesses like RSV, especially RSV with pregnant women and children. There are some preventative measures that we can take that can lead to improved outcomes in kids with this virus.
Right. And if you or yourself are sick, just don't go to grandma's house. Stay home and recover. Dr. Amanda Thomas with Bluebird Kids Health, thank you so much for your advice today.
Thank you so much.